risk, 1 in 8, look around and how many people are at your table, of being diagnosed with breast cancer. Every 2 minutes, 1 case of breast cancer is diagnosed in the United States. And we've had more than 250,000 people diagnosed this year already with invasive cancer. And 2,500 men will be diagnosed this year. So a final thought before I introduce Dr. McConney. And I want you to think about this when she's talking. It's the power of one. The power you have. Everyone, to make changes in your life. To take your health into your own hands. Because it's only you that can make those changes. And there are no excuses. We have to make changes in our life. And we're going to see this, okay? All right, enough preaching. Okay, so I'd like to introduce, and I want you to take a look at your bags and know about your bags. We talked about a research protocol that we were a part of. It was nationwide, but in your bags, there are different research protocols that people can take advantage of. There's listed here if you're a breast cancer survivor, a patient, whatever, and they're very important to consider because research is how we get here and how we get good information. Dr. Neha Khan is an oncologist hematologist specializing in the different cancers at the Watson Clinic Cancer and Research Center. She received her medical degree at Boston University and performed fellowships in hematology oncology, one at the University of California and another at the Harvard Medical School, Beth Israel, Deaconess Medical Center. She completed her internship and residency at the University of California, and she is board certified in both hematology and medical oncology, and I'm delighted to introduce Dr. McConney.
Good afternoon. It is my honor to have the chance to speak to all of you today. I am a medical oncologist, a cancer doctor at Watson Clinic, and I have had the privilege to take care of many of you and many of your families. Multiple times on a daily basis, I sit with strangers and tell them the most horrible of news, the words that everyone dreads to hear: you have cancer. And after those 3 words, I can see that blank stare on my patients, the thoughts that must be running on through their heads, that I'm about to go on a cruise next month, or I just retired last week, or I'm starting a new job tomorrow. My daughter is about to have a baby in 3 months, or my kid just started kindergarten. We all have plans, and cancer is not on that agenda. There is no convenient time for cancer to arrive, but it gets thrown at us when we are least prepared and most vulnerable. It is scary. We feel anger, we feel betrayed by our own bodies, and we keep thinking back about that last doctor who we saw, and how come they didn't find it? We feel helpless, and we feel as if we have no control. Today, I'm here to talk to you about the control. Today, I am here to share with you what science has taught us about how we can prevent that breast cancer from coming back. We may not have control over who our parents are, which genes are handed down to us, where we grow up, what air we breathe, or what environment we are in, but we do have some control. The American Cancer Society estimates that there will be over 200,000 new cases of breast cancer in 2019, of which only 5 to 10% will be due to family history or genetic predisposition. 90 to 95% of the breast cancer cases will be related to some environmental risk factor. Every day, patients ask me, what can I do so that my breast cancer never comes back again, so that my family does not have to go through this horror again? So let's talk today about what you can do. So diet. We are what we eat. Our physical and mental well-being comes from what we eat. And there have been over 100 studies looking at the link between breast cancer and diet. And from these studies, there are a few conclusions that can be made. First, poor dietary characterized by the high intake of refined sugars, starch, saturated and transsaturated fats increases the risk of breast cancer. And we know this to be exceptionally true in postmenopausal women and the increased risk of getting hormone receptor positive or estrogen or progesterone-driven breast cancers. So where are these fats found? Trans fats are found in crackers, cookies, cakes, frozen pies, microwavable popcorn, frozen pizza, fast food, and coffee creamers. And when we talk about saturated fats, yes, those coffee creamers. So when we talk about saturated fats, those are found in fatty beef, lamb, pork, lard, cream and butter, and cheese. Saturated fats are not only related to an increased risk of breast cancer, but it also increases the risk of heart disease and obesity. These foods have tumor-promoting potential because these foods increase circulating levels of insulin and other factors that play a critical role in tumor growth and tumor progression. There have just been a handful of studies looking at the association between high animal protein intake and the risk of breast cancer. But no study as of yet has been able to show a direct cause. But we do know that certain types of animal protein does increase inflammation in our body. These are most notably red meat or processed meats like salami, pastrami, bacon, whereas chicken and turkey has not been shown to be so detrimental. But many of us have soft spot for bacon. It is still better to get most of our protein from plant-based sources, such as beans, or other sources such as eggs, low-fat dairy foods, or fish. Thirdly, alcohol. Alcohol is known to be a risk factor for several types of cancer, including oral cancer, esophageal, colon cancer, liver cancer, and breast cancer. Specifically, alcohol intake is associated with breast cancer in both pre- and in postmenopausal women. So 1 drink a day increases the risk of breast cancer by 10%. 2 drinks a day increases it to 20%. And generally, 1 drink is defined as a 12-ounce can of beer or 5 ounces of wine. For most breast cancer survivors, drinking more than 1 drink a day increases their risk of breast cancer coming back 7 times compared to someone who drinks more than less than 7 drinks in a day. So drinking does increase the risk of being diagnosed with a second breast cancer in the opposite healthy breast. However, for those wine lovers in the audience, there is a glimmer of good news. A study at Fred Hutchinson Cancer Research Center showed for that those women who were diagnosed and treated with breast cancer, a moderate amount of alcohol use after a breast cancer diagnosis will not lead to a lethal recurrence. So what that means is though alcohol can be used between breast cancer survivors, and we know that there's a link between breast cancer coming back, it is not associated with an increased risk of dying from that cancer. So the key take-home point here is that moderation is very important. An occasional glass of wine does not seem to impact a woman's risk of dying from breast cancer, but it must be in moderation. Moving on to dairy products. So there have been a lot of contradictory results related to dairy products and whether it really increases or decreases the risk of breast cancer. But studies have consistently showed that in premenopausal women, higher take of calcium and vitamin D protects them from getting breast cancer. Soy foods. So soy milk, tofu, soy products have a natural compound called phytoestrogens. And phytoestrogens chemically look very, very similar to our natural estrogen that we make. And so there's always been a concern that maybe soy products can cause breast cancer. But studies have really been inconclusive about this. And the most recent studies actually suggest that occasional intake of soy products is actually probably acceptable. However, those supplements that contain phytoestrogens, that's your black cohosh or your red clover, that is not safe and that is not recommended. That can increase your risk of actually getting breast cancer. So the World Cancer Research Fund recommends that women who have had breast cancer follow a certain diet to reduce their risk of cancer coming back. This should be a healthy diet that has high fiber, fruits, vegetables, omega-3 fatty acids, like Dr. DuPont says, a colorful plate. Foods that are rich in fiber include things such as whole grain foods, brown rice, whole wheat, couscous, quinoa, lentils, beans. A diet that is rich in fruits and vegetables is important because this is our only source for vitamin C, carotenoids, polyphenols, all of which counteract oxidative stress, cuts down inflammation, and reduces the chances of the cancer coming back. And omega-3 fatty acids, this is usually found in fish, fish oil, flax seeds, nuts, and eggs. These have anti-inflammatory properties, which is essential in trying to prevent breast cancer from coming back. So aside from diet, obesity is also an important preventable cause of cancer. 15 to 20% of cancer-related deaths each year are simply due to obesity. This is right below tobacco use. Studies have demonstrated that in postmenopausal obese women, there's a 25% increased risk of developing breast cancer. The evidence has also shown that it not only increases the risk of developing breast cancer, but it also increases the risk of breast cancer recurrence and breast cancer mortality. The link between obesity and breast cancer risk is based on the fact that being obese, having more fat or adipose tissue, leads to chronic inflammation. And when you have chronic inflammation, your body produces bad hormones, bad steroid hormones, and this causes tumors to grow and spread. Over 100 studies have been done that show that regular exercise decreases the risk of breast cancer development by 20 to 40%. Exercise reduces levels of those bad hormones, the insulin, the estrogen, the insulin-like growth factors. And reducing that inflammation in your body only boosts our own body and our own body's immune system to fight against the cancer. The American Cancer Society recommends that all adults engage in at least 150 minutes of vigorous, intense activity each week. So that's 30 minutes of activity at least 5 days a week. And what are examples of this moderate, intense activity? That's a brisk walk, dancing, leisurely biking, yoga, golfing, double tennis, softball, or just general yard and garden maintenance. Now, if someone is more physically fit and can do more vigorous, intense activity, then just 75 minutes a week, or just 15 minutes, 5 days a week is beneficial. Examples of intense activity is jogging, running, fast bicycling, swimming, aerobic dancing, soccer, singles tennis, or basketball. It is so important for us to be active. It is so important for us to limit the time we spend sitting stationary in front of our TV, our laptops, or our computers. And for those in the audience who suffer from chronic pain or arthritis, there are incredible arthritis programs available in various gyms and club memberships, including our local YMCA, which has not just a cancer survivorship program, but has a dedicated arthritis program, where you can actually learn about how to use those machines, which machines are good for you, what exercise classes will strengthen your bones, your joints, and your ligaments. Do not let pain hold you back. Do not use pain as an excuse. In fact, regular exercise can improve chronic pain and those arthritic changes. Many patients also ask me, how does daily stress and stressful life events relate to breast cancer? There is mounting evidence linking stress and breast cancer risk. Stressful life events and negative emotions increase cortisol production in our bodies, and that leads to a downstream effect of releasing bad inflammatory markers. That lowers our immune system and then increases our chances of getting breast cancer. Those who suffer with chronic stress and stressful life events not only have an increased risk of getting cancer, but also other health problems, such as obesity and heart disease. But it is inevitable that stress and stressful life events will occur. It is how we cope with these moments. Yoga, meditation, breathing exercises, relaxation with imagery. All of these techniques have been studied and have demonstrated time and time again that these methods do help patients who suffer with cancer. There have been over 17 studies looking at the role of yoga and how it improves the quality of life in patients who suffer with cancer. Neuroscience and psychology has demonstrated that through yoga and meditation, one is actually able to change the neural network within our own bodies. This means that we have the capability to change the hardwiring in our minds. By routinely practicing yoga or meditation, studies have shown that this cuts down pain, GI symptoms, postmenopausal symptoms, and fatigue. Yoga, meditation, all of these enhance our physical and emotional well-being and brings back that peace that many of us thought we would never get after we were diagnosed with cancer.